Well, hello everybody. My name is Brett Stompro, and I want to thank you guys for taking the time out of your busy schedules on this rainy evening so that I can talk about some of the things that I love. And so we're going to talk about plastic surgery in general. We're going to talk about facelifts today. And the first thing that I want to do is once again tell you how honored I am that you guys are here. Our practice has been around for over 50 years. I've been doing it right here for 30, and I have an amazing team. And most of the people that are right over there, dressed in black and periwinkle and white coats, they're here to take care of you. And so they know a lot of the stuff that I actually don't know about, like scheduling and cost and all that kind of stuff, but they can kind of help you through that very much. And then I'm also very honored to have a couple of patients here that are willing to actually share their stories. And this is kind of personal stuff. It's always a little, most of the time, people, when they do have something like this, particularly a facelift, they want it to kind of fly under the radar. They want to come out looking natural, and so they want to kind of keep it to themselves. So we have a couple of people here tonight that are going to kind of share their stories, and hopefully that will educate you guys a lot. And just a little story about people wanting to keep things quiet. I remember when I was helping my senior partner with his wife's facelift, and so she wanted to kind of keep it under the radar, didn't really want to tell anybody. So that Sunday in church, the pastor said, does anybody have anything that they'd like to pray for? And she was there with her grandmother, and the little 6-year-old daughter raised her hand. So she invited her up. So she got on the microphone. She says, I'd like the congregation to pray for my mommy's facelift. So, try as you might, you never quite know. But the key is you want to look good. And the question is, how do you make the decision? There's so many different types of facelifts out there. There's so many different types of surgeons out there. So hopefully tonight we'll be able to answer some of those questions, and I'm once again really honored to be here. Okay, so the image of beauty, we've known it. When we see it, we can really identify it. And typically it's that beautiful high cheekbone, it's that sleek jawline, it's those full lips, it's that nice demarcation between the jawline and the neckline. But as we know, as we age, and there's another good example of it, but as we age, things change, okay? And really, the aging occurs in 3 major domains. The first domain is that we lose our elasticity, okay? And what happens is that the muscles in the skin starts to come down with time with gravity. The second major domain of aging is that of volume loss, okay? So where the fullness that we typically had up in our cheeks and our lips starts to dissipate. And then the third major aspect of aging is the skin, where there's actually lines on your skin and things get etched, and so we have deeper wrinkles. So the question is, how do we take care of these things? And typically, aging is not a segmental thing. Usually if you're going to age in the lower face and the neck, there's going to be some aging in the brow, and there's going to be some aging around the eyes. And so most of my cases are going to address all 3 aspects of that aging face, namely the loss of elasticity, the loss of volume, and the external skin. So when we're doing this, we're doing lifts like facelifts and brow lifts and eye lifts to restore that elasticity and get things back up where they used to be. And then what we also do is we restore some fat with fat transfer. And with fat transfer, we harvest a little bit of fat, we spin it down in a centrifuge, and then we re-inject your own fat back into your cheekbones, back into your lips, into the folds to soften them, sometimes into the temples, to restore what you used to have. And so that's one of the things that I like to do, is get photos of people in their 20s, 30s, and 40s so that I can kind of see where they started from, what the progression was, and what I'm trying to achieve. And then the final thing that I oftentimes do is we'll be doing some resurfacing of the skin depending on the complexion of the patient. Darker skinned individuals, we have to tread a little lighter, and usually they're going to be in the Medi Spa. There are various generations of facelifts. And come right on in. And what Sam said about continuing education and making sure that you're, basically evolving with better technology and better knowledge is really key. And there's various generations of facelifts. The first generation of facelift is the skin-only facelift, and that was very popular in the 60s, 70s, and even the 80s. And they led to quite variable results. The skin is not a structural component. It's not meant to hold things up. And then we got smart, and we understood that now we had to go into deeper layers. And having an intimate knowledge of anatomy, like what Sam said, is really important. I used to teach anatomy at the medical school, and knowing the layers, knowing the ligaments, knowing where the muscles insert and originate, where their blood supply is, where their nerve supply is extraordinarily important, okay? So staying up on that, and you'd think that you would just kind of know, once you learned it, but there's all kinds of evolving techniques to know additional things about anatomy, particularly of the face, that's very complex. So in the 90s and 2000s, we got smarter, and we understood that the skin is not going to lead to a great natural result, and it's not going to hold up. So we had to now operate at the deeper layer. And the deeper layer is the muscles. So we lift the skin, and now what we do is we're putting sutures, we're putting sutures in the actual muscle layer. Sometimes we'll remove a little bit of that covering of the muscle. We'll do a little bit of that, and then what we'll also do is we'll kind of sew that back together so that it tightens the muscle a little bit. So that's kind of the second generation facelift, and that's the facelift that the vast majority of our colleagues are doing. Basically, most of them they learned how to do a technique. They make their patients relatively happy. They get, average results, and their patients are happy, and then they just continue to do that. But I've always been driven to kind of try to get the pinnacle. With pretty much all aspects of my life, and so I looked at my results over the first 10 years and then the 20 years, and I said, there's got to be a better way. Like I saw, it wasn't long ago, I was actually at Christmas time, I went to the country club over with my wife to a little Christmas performance. And I ran into this lady, she came up to me, Dr. Stomper, you did my facelift 20 years ago. Thank you so much, don't I look great? It's holding up beautifully. And I gave her a big hug. But I was looking at that facelift that I did in 2005 with 20/25 eyes. And I said to myself, there's gotta be a better way. And so what I did was I went on a search across the world and basically identified the master facelift surgeons that I really admired. And I wrote letters to them, I called them up, and they said, you're more than welcome, Dr. Stumper. So I went into their operating rooms, and I actually sat right there next to them, intraoperatively, lifting the skin, and then actually, saw what the maneuvers that they were doing. And then I would then take their courses, and then I would read their book chapters, and then I would then visit them again, and we would take a cadaver course together. And so I really kind of searched, and I kind of took a little recipe from each of these master surgeons, and it was very rewarding to see that there was indeed a better way. There was a way to make sure that the variability of the results that you saw with some of the stars that go get messed up by somebody in Beverly Hills, there was a way to make those results much more consistent. And by doing that, you have to have a knowledge of the entire breadth of the techniques. So what is the later generation techniques that I've learned? And the third generation is basically working in the deep plane. You guys have heard that a lot. And about 10% of plastic surgeons across the country know how to do these deep plane techniques, which means that not only are you staying on top of the muscle, but you're actually going under the muscle. And by going under the muscle, what we now recognize is that there are some restraining ligaments, okay? And again, this is, like I said, I'm doing a different facelift than I did 5 years ago. And by the knowledge of those restraining ligaments, you can pull on that muscle all you want, it's only gonna go a certain amount. But if you can do a targeted release of that ligament, now you can redrape that muscle back up where it used to be. It'll look much more natural, and it's gonna last longer. And again, it takes a long time to learn these techniques. It takes, the tutelage of a master surgeon coaching you and going to their operating rooms, and it is fun to be able to do, because we feel like we're really unlocking the mystery of the ideal facelift. And it's very different. A lot of people say vertical lifts are the best. Well, actually, if you go too vertical, you know what you're going to do is you're going to get a snarl, and if you go too lateral, you're going to get kind of a joker line to their mouth. So it has to be in line with, that's parallel to the zygomaticus major muscle, and that vector has to be just absolutely ideal. Now it's different for everybody, but again, that's where artistry comes in, okay? And you know, what is plastic surgery? Why do they call it plastic surgery, okay? We don't use plastic, do we? Well, plastic surgery comes from the Greek word plastikos, which means to sculpt. And I grew up wanting to be a dentist like my dad. But one of the things that I would do as a little kid is I would sculpt in clay. And I would go down to my dad's office, and he had these models, and I would extract teeth, and I'd carve a tooth out of wax, and I'd put it back in, and that kind of stuff. And my mom said, "You don't want to be a dentist." I said, "What are you talking about?" You need to be a plastic surgeon, because that's where the artistry comes. And so that's what always stimulated me to go into that. So I asked my dad, I said, "Hey Dad, you know, Mom doesn't seem to think I should be a dentist. What do you think?" He says, "Your mom's right. Be a plastic surgeon." But anyway, so you know, what we really have unlocked the mystery of the face. But the question is the neck, because really the neck is how we are judged. Okay, and so a lot of times we were doing the same mistakes that we were doing. This is not done by me. This is an unknown surgeon, but they came in to me for a consultation. But the thing about it is, a lot of her subcutaneous fat was removed with liposuction, and they pulled on the skin. Well, we know that the skin is not a structural component, and we can see her platysma muscles that are still banding there. Also, there's this structure there called the submandibular gland. And you can do the best tightening in the world, but if there's fullness in the neckline, it's not going to be addressed unless that is contoured as well. So again, the structural neck lift is kind of that 5th generation to be able to really now go into the deeper segments of the neck, under the muscle, trim those submandibular glands, modify some of the deep fat structures so that you can get a more defined jawline. So these are examples of people that have had lifts, but then there's a recurrence of it. And you know, these are the things that frustrated surgeons for so long, that the structural neck lift, going into the deep neck, is really the key. And I actually had the honor of being asked by my professional society this year at our national meeting in Austin to moderate an international panel on the advanced facelift and deep neck surgery. They selected me because they knew that I was very passionate about it, and that they knew that there's a younger generation of surgeons that are learning techniques, and this needs to be implemented, because in order to deliver the very best results, you have to have the best techniques. Now, that's not to say that only one technique is best for everybody. You know, when I sit in front of somebody, I'm analyzing their face, I'm asking them what they don't like and what they'd like to correct. And then I'm gonna give my artistic input as well. And sometimes it's gonna be, you know, a deep plane, sometimes it's gonna be a high smash lift, sometimes it's gonna be a more vertical lift, sometimes I don't need to go into the deep neck. But again, diagnosis is everything. And so when you're doing these procedures, it's very artistic, but it's very technical, and you have to have both aspects of it. So the contouring in the deep neck has to do with the subcutaneous fat, but also the gland. And you can see somebody here that doesn't have very much of a gland, not a lot of fat. They're going to do fine with staying, you know, on the more superficial layers. But if you have a larger gland, if you have more submuscular fat, see, this is subcutaneous fat right here, but this is submuscular. See that little red line? That's the muscle. That's the platysma muscle. If you just try to suction it, you'll never affect that aspect of the deeper neck, because you can't get in there with a suction cannula. So now you have to open the neck. You have to go into, you know, kind of the deeper aspects, go underneath the muscle, and then modify that appropriately. Because otherwise, if you're pulling on the muscle, pulling on the skin, it's kind of like pulling a belt tighter on a beer belly. It's just going to spill out somewhere else. So that's why doing that modification of that deep neck is so important. So once again, very, very honored that Dawn is here. Dawn came to me after having a couple of facelifts, and she was a little frustrated. And so, you know, again, it shows you the difference of the techniques. And only about 10% of plastic surgeons know how to do these more advanced techniques. So, Dawn, come on up. Come on up. Thank you, Dawn. So, you came to me how long ago? A year and a half ago?
Yeah, a little over a year ago.
Okay. And basically you came in and you were looking for this. And tell your story.
So it was actually my third attempt.
We want to see you.
This was my third, not only attempt, but finally my last attempt. And satisfaction, because as he was saying, I went to places and I didn't know what I didn't know. So they basically just told me, oh, we can pull this and blah, blah, blah. And what I know from my profession, I'm an ultrasound tech, I kept thinking, I have the submandibular gland here. I'm like, this is in my way, and they can pull all the skin I want. Until I came here, he said, we need to fix this. And I was like, thank God. So it wasn't so much that I told him I didn't want to look younger. This has been my whole life, because that's how I was built. And I thought, maybe if God doesn't want me to be built this way, that's fine. But lo and behold, there's procedures now that can fix that, and people who can fix it.
That's why God invented plastic surgery.
That's right. Third time's a charm. So I finally got what I wanted and needed. Thank you very much.
So again, so you had a facelift about 10 years before, or
The first
12
one
years?
I was about 41.
Okay.
I'm 56 now, and the second one was only, so it's a year, so it was about 3 years ago. Because I came to him over 2 years, and I said, I don't see any difference. And people who knew,
Go backwards.
yeah, people who knew I had it done literally picked out the before picture, thinking it was the after. That's how much of no change there was. And I was like, no, that was before.
And think about how disappointing that is. I mean, you're investing a lot of money, you're laying on the operating table, there's a recovery involved, and then to not get those results. But what I'm so excited about is that by really being relentless about looking at these techniques and visiting other master surgeons, we're able to really kind of collaborate. And now people are coming to my operating room and looking over my shoulder, and that's very gratifying, because I want to teach them the right way to do this, because the better results there are out there, the better for everybody. And then this is just a year after your other facelift, right?
Yeah.
Okay, and so, she had excess in through here, but again, it wasn't a matter of pulling on the skin. And then the other thing that we did for Dawn is we did do some improvements in her upper lids. I forget if we did your lower lids. We did some fat transfer. Did we do any laser resurfacing? No. Yeah, because again, slightly olive pigmentation, a little darker complexion. But again, you guys can, tap her on the shoulder. She can, show you her incisions. But the thing about it is that it's not a matter of so technical. It's a matter of how she feels. Okay, when she walks into a room, she feels very confident, and she didn't feel that way before. And you look remarkable. You're striking. You're very beautiful. But now you also have that little spark.
Did not want to wear my hair in a ponytail. Thank you.
Any questions at all? Any questions at all? Now, I will say that a lot of people, when they're thinking about having a procedure done, it's kind of human nature to think, well, I don't want to look overdone, so I kind of want to have a more minimal approach, okay? Because that kind of makes sense, right? A minimal approach, minimal improvement. You look good, look a little better, you won't look overdone. But really, it's really very important to understand that what we're dealing with here is anatomy. So when we're lifting the skin and we're repositioning the muscles and we're trimming glands, these are more advanced procedures. They take longer in the operating room. And it also takes longer to recover. Morgan, come on up. Morgan's our clinical director for the last 21 years, and she's seen various generations of facelifts, right?
Yes, that is true.
So, how many different times, you've seen the evolution over years.
Oh, 100%. I'm not just saying this because, he's my paycheck. That's not who he is now. Okay, there's several patients here in this room that I think I've worked with, and he's never satisfied, so he's always looking to get better. So one thing is the tension behind the ears and pulling on the skin and not having that muscle to kind of elevate it. So that's number one. And then number two, I just saw a patient a year or two ago, Dr. Sombro, I don't like that her glands are there because her first facelift was in 2012. So he redid that because again, he wasn't satisfied. So
Yeah, she came in and she was gonna have some injections, and Morgan walked by her and said, no. You're not gonna invest in that. Dr. Bumple's gonna wanna do your neck, because there's better techniques.
100%. So I think even there's someone that's gonna come up and speak in just a second, but this is the best facelift that I've ever seen right now. And it's very much talked about on the market, but it's longer lasting, it's definitely youthful, and it proves its point.
Do you also wanna talk a little bit about the recovery? Because again, people are looking for, I want just a little something and I want kind of a short recovery.
Yeah. So there is a lot of people or patients will come in and say, I just want to start with my eyes, or I just want to start with my neck, but really it is truly, you got to do it all together. They're brother and sister. If you do your eyes, now your neck stands out, and vice versa, right? So it really is true to rejuvenate everything. I always say, look at the brow to the upper lids, look at the lower lids to the cheeks, and look at the mid cheek to the lower neck. And really, they're all aging together. So if you haven't done anything yet, really kind of look at yourself in the mirror and really say, you know what, do it all at one time. But I will tell you that if you do go on the internet, what you see is real, okay? I mean, if you're a professional boxer in a boxing ring, you get hit one time in your eyes, you get a black eye instantly, right? So the face has a lot of blood vessels, our eyes are a wet organ, it produces a lot of tears, the eyes swell, we do bruise, but it's all worth it if you could just get through those first 10 to 14 days.
A little bit longer for recovery, but the result is gonna last you much, much longer.
Especially when you're adding in other things like the fat transfer and the laser. Just be really patient, trust the process, have the most, supportive, support system with you at home, because it's definitely worth it, but those first 7 to 10 days can get a little overwhelming.
Sia's our PA, and after, over the last 10 years, you've kind of seen our preoperative screening kind of change quite a bit, as well as our intraoperative kind of treatment, and with additional agents under anesthesia, and then also postoperatively with regards to blood pressure checks and such. Do you want us to speak to that for a little bit?
Well, a big part of my consultation is really diving into your health history, because that is number one, is keeping you safe. So our pre-op process, our consult, our patient intake is really important to keep you safe. So if you have any type of cardiac issues, lung, breathing issues, anything like that, we really make you go back to your doctor and get a written sign off, a clearance from them to make sure you're nice and safe. We have a 100% safety record here, so that's really, really important to us. And number one is keeping you safe, because this is, again, elective surgery. You don't need these things, so just more of a reason to keep you very, very safe.
In that second generation facelift that most of my colleagues are doing, it's not quite as in depth, but with what we're doing now, we're having patients check blood pressures, and there's
so post-operatively now, so we have you get a little blood pressure cuff at home, and you're checking it, just making sure your blood pressure is in check, and we don't want you to be stressed out and your blood pressure to be high, because that will cause more swelling, potential bleeding. So we really keep you in check. You're on the phone with our nurses pretty much daily for check-ins, so it's all about safety and keeping you comfortable as well.
Very good. Yeah, the safety aspect is very important. We have our surgery center right down the hallway there, fully accredited, 100% safety record, and our anesthesiology team has been with me for over 20 years. You can't find that kind of consistency anywhere else in the country, because again, you want somebody that is really skilled and knows how long these procedures are going to take. Most plastic surgeons, when they walk into the operating room, they don't have any idea who their anesthesiologist is going to be, and sometimes they're meeting for the first time. But I hand selected these guys. They're colleagues of mine, they're friends of mine. They've done my anesthesia, my wife's anesthesia, my daughter's anesthesia. These are people that we really trust. And so when you're on our operating table, there's no guesswork. The person handing me my instruments has been doing it for 22 years. And so when I put my hand out, I know the right instrument's gonna be there. And there's other, plastic surgery, we'll talk about it a little bit later, but plastic surgery is a very diverse field. I mean, breast, reconstructive, microsurgery, facial, post-traumatic, all that kind of stuff. But when you're dealing with just faces, this is a really important thing. There was a celebrity that not long ago said the most important decision that you'll ever make is who is your plastic surgeon. And people, kind of looked at her and said, why did you say that? She says, well, I can move and get a different house, I can get a different job, and I can certainly get a different husband. But I can't get a different face. So, and you can't hide this. If your breasts are, a quarter of an inch off, that's okay. But it has to be ideal here when it comes to your face. And that's a little bit like cutting diamonds. So, with knowing the techniques of doing deep neck surgery, we can now help a person like this who's in her 30s. And she had lipo of the neck elsewhere, okay, where you stick a little cannula in, suck a little, tablespoon of fat out, and that didn't help her. And so she came back to me asking, can you do a little bit more suctioning to my neck? But just like Dawn's situation, there were structures here that needed to be modified. And so with only one incision right here and just around the earlobes, then we were able to do what's called a short incision neck lift. And we were able to go in under the muscle, modify the deep structures, tighten the neck muscles, and then re-drape the skin. There was no trending of skin at all, okay? Because the distance between point A and point B is actually a little bit less than the difference between point A, point B, and point C. And so it just re-draped. So for some people, they're good candidates for short incision neck lifts, typically younger people with good elasticity. But with knowing these deeper techniques, we can help men. Most men, they don't want to come in with the incisions, this and that. They want something that's a little bit more targeted. And he just wanted a better jawline, and he loves his neck now. No skin removal. Okay, so again, this is a lady that came in, very typical. She's around 60. I mean, anywhere from kind of mid to late 40s to kind of, late 70s. I mean, I did an 83-year-old's facelift not long ago, but again, there's certain 39-year-olds I wouldn't touch, but she was, vibrant as heck, exercises every day, and so, it all has to do, like Sia said, about the health. But she just didn't like, as she aged, how square her jawline was getting in the excess into the neck. And by doing that more modern type of facelift, we're able to kind of hide the incisions back inside the ear canal. We did put a little bit of fat into her cheeks, and then she just needed a little trimming over here, needed a little modification there to even out her eyes. So some people just need a little bit. They don't need everything. And this is a lady that is very beautiful, and she came in and wanted some work done. So we did her nose, and we did her neck, and we did her facelift. She also came in for a little bit of body work, okay? We did her breasts, we did her lipo, we did her tummy tuck. She goes to the gym every day, and she happens to be here. You can think it's
I had it all. I retired a while ago, and a couple years after I retired, I thought, we have nothing planned. Let me just, think of what else I can do. So I was actually I know. So I was actually having my face waxed, and the lady said, have you thought about having a facelift? I said, who doesn't at my age? But I'm not going to spend the time to research where I should go. And how do you know? And she said, well, and she was a friend and patient of Dr. Stompros, and she handed me his card, and so I had her recommendation, and she said, and the lady in the next office also had a facelift by him. So I talked to her, and everything I wanted. I called my sister, got the first appointment. My sister met me here and signed me up. I just fell in love with Dr. Stompros, the staff, felt so confident, as you all do by now after listening to him. And so we started with a facelift and went from there.
And tell your age, Mary.
Oh, I just turned 79.
Wow!
Mary also is an example of the evolution, because we did Mary's first facelift, 10 or 12 years ago. She had a great result, enjoyed it, this and that. And as we were doing her body, we just, saw how things were progressing and aging, and we said, we can do better. And she says, sign me up, let's do it. And so then we did the more advanced lift on her. So she's a good example of how some of my patients, even though they might be happy when they hear about that there might be a better alternative, these techniques are important. So when you're researching your surgeons, make sure that they are doing the techniques that you're looking for. Thank you, Mary. Just another example of, again, addressing the muscles, the deep neck structures. She had a little bit of eyelid work and a brow work, but mostly, we're judged by how well the neck looks. That's the thing that Dawn didn't like about her previous life, is that the neck didn't really change, and that's really how we're going to be judged. Another example of just relatively large neck. We did some fat transfer. I used to do lots of chin implants. Now I put fat in there so patients' own fat can give them a better jawline. Another example of somebody with lots of extra skin, sun damage. She had lasers. She came back for her body as well. Another example, of somebody, she had a brow lift. We took away some of those frown lines. We did her eyes and we did her neck, to be able to really give her some nice improvement. We always shoot for 100% improvement, but again, there's always, a little something that, that is lingering. Every once in a while, we have to go in and do a little touch up, but, with patients, they know that we're very committed to getting them to that finish line that they want to get to. Another example, again, lots of excess into the neck, doing the advanced techniques. She looks natural. She looks better. We don't want to make people look overdone. Guys have it too, okay? Particularly in industry, the workforce is very competitive. And so, youth is exalted in the workplace. And so people that, want to stay, with that cutting edge, they oftentimes are coming in for procedures. And it's very important. Incisions can be made poorly if there's not attention to detail. This is from elsewhere. And again, you can kind of see that if somebody was next to you at a dinner party and whispered a secret to you, you would easily, the telltale signs of a facelift would be there, and how things are done, if there's tension on the incisions. These are unsatisfactory incisions that really can be avoided by doing the right maneuvers, not concentrating on the skin, not pulling on the skin. When we redrape the muscle, there's extra skin there, and we simply trim it. We don't pull on it, we just simply trim it so that those incisions should be imperceptible. We make the incision back inside the ear canal. The angle of the ear is taken into consideration, as well as the dangle of the actual lobule, making sure that people have the confidence to wear their hair up. It does take a time to heal the tree, and we can improve that. Volume restoration is important, and so, yeah. So recovery, how long does it take to recover? Well, you can talk to Dawn, you can talk, the other patient that we have here tonight is also named Dawn, and they're both very beautiful. And so you can ask them, okay, yeah, so this is actually my wife, and so she came in and I talked to her out of facelift for a long time. She said, no, you're finally doing it. It was about a year ago. And so I met her in junior high school, and I asked her to go steady when you were 13. So, anyway, she looked beautiful to me, but this is her the day of surgery. This is how you look. You're relaxing.
And she had everything done.
Yeah, she did her brow, she did her upper lids, she did laser, she did fat transfer, she did a facelift, lower lid blepharoplasty, and here she is, the first day. Day 3, she gets, a little bit better, but she looks kind of banged up. And again, this is actually not as traumatic for the patient. Okay, the patient is kind of prepared because they've spent a lot of time with Morgan, a lot of time with Sia, a lot of time with Alexis and Eve and Janine. They've talked with our team. They know kind of what to expect. But sometimes the husbands are kind of like, whoa, what's going on here? What did she get herself into? And so there's a lot of preparation involved. But you can see that after a period of time, it does get better. And you can put a little bit of makeup on. You're not really camera ready. I would say that most people are returning to an office environment by about 2 weeks. And then I would say that you can go to a wedding or family reunion by about 6 or 8 weeks. And again, sometimes it's a little longer. Sometimes people smile a little crooked. for a couple weeks. Sometimes people have an incision that's, a little slower to heal. One side has more swelling, and so, people's expectations, they have to kind of clear their social calendar for a bit so they're not overextending themselves. Yep. And it just continues to improve. Swelling, particularly into the neck, gets better and better with time. Okay, we have another patient. Come on up, Dawn. Yes, thank you for being here.
Woohoo, Dawn!
One of the things that I said earlier is that doing a facelift is a lot like cutting diamonds, because you have this valuable thing that's priceless, and now you have to cut it just right, and you have to make sure that you do the right cuts the right way to create something that looks even more beautiful. And so when Dawn and then Dawn come into me and I'm looking at them saying, oh my gosh, they're so beautiful to begin with, it's like, I better be on my game to be able to make them and be able to fulfill what they want. And that's not easy. It takes focus. It takes concentration. To do a heart transplant takes 3 hours to do. But to do the procedures that I did for Dawn and Dawn, those are going to take 6 hours, 7 hours sometimes. And I have a great team. We're very dedicated, but it's an investment in terms of the time that it takes. So you came in, how long ago?
So when I first came to see you,
Yeah.
it was probably June,
Okay.
May or June.
Yeah.
This year, it's just done, 3 months in. I think what I loved most about that interaction with Dr. Stompro was just the things that he was explaining to me of what he could do, and asking me especially that one question, what don't you like? And I was like, well, this and this and my neck and all the things, and he said, well, whether we do this next week or in 3 years, we're gonna still be able to get the same result. And that now or in 3 years, it didn't really matter. There was zero pressure, zero anything, but the explanation was super interesting, and it's like, well, I don't wanna wait for all this wonderful stuff, so let's just do it all now.
Yeah, and this is an example of somebody that looked good. You can see her pre-op photos. She looked pretty darn good. Okay, and she had a little bit into the neck, but everybody that met her before surgery thought that she was breathtaking. And she's a very high-powered businesswoman, and she works 50 hours a week, a lot of times with men, and so she's in a high-powered industry, and she just felt like she wanted to maintain that edge. And so when you look at her, she had a little bit of volume loss into here. She had a little bit of relaxation, but not much, into the jowls, into the neck. We knew that we could help her. She had some irregularities of her skin. She had just a tiny bit, of excess in her upper lids, a tiny bit of droop to the brow. And so we ended up, again, even though she started out really good, we did everything. We did an endoscopic brow lift, we did the upper eye lift, we did the fat transfer, we did the face and neck lift, we did the upper lip lift, and we did the full face laser resurfacing. That's a lot for somebody that looks pretty good. It's like, geez, why am I doing all that? But you look at her now, and now she has that spark. You take a look at her neckline, she looks good. So tell me about the process of, kind of making the decision, and then kind of leading up to it. How were you nervous, and then your education process, and then post-op.
Yeah, I think for me it was knowing that, I think I've always had an idea in the back of my mind that I would probably do something like this at some point in my life. I also didn't want it to be a very big drastic change, so waiting till I was 70 or 75 and then doing it, or 65. Also, my husband was not really interested in me doing anything this no, and it was always, why would you do that? Everything's fine. And I said, well, it's for me. I spent my whole life working really hard just on staying healthy. And to Dr. Stompro's point, I do work a lot in the health industry, and it's competitive, and you want to feel good in your skin. And so that process was really what drove me to do this. And in addition to that was to do all of it at the same time, because everything is linked. And I also knew that if I'm going to do this, downtime for me was pretty important. I needed to know exactly how long I was going to be down for, because I do work a lot, I travel a lot. So that part of just getting that understanding of like, you know, yes, this can be done, and this is how much I want to do, and I want to do all of it at one time, and I don't want to wait long. I don't want to wait the 3 years. He said you could do that. You could wait 3 years, 5 years, whatever it took. I wanted to do it now. So at the age of 56, I decided that this is what I was going to do. It was about 2 weeks is the worst. The first 2 weeks is the worst, and I remember calling Dr. Sombro and saying, yeah, I remember calling him, and I think I started to cry on the second day, and I didn't really need the pain pills or anything, and he's like, take his Xanax. Like, he's like, don't try to be a hero, and I'm like, okay, and I took one Xanax, I think I only needed one. It was like the second day, I think I was falling apart, just crying, you know, and I had no idea why I was crying, but, that didn't really bother me, and nor was I hurting, but, once I took that,
A lot of emotion.
I was like, everything's fine, this is fantastic. He was very concerned the first few days, actually the first couple weeks. And that's a lot of
And
that.
I've met her husband, and he's got some pretty big muscles. This picture really surprised me when I took the side view. I felt like my profile was just amazing, and this was, again, not even 2 weeks, this was maybe a week and a half. And I was just so pleased already with the neckline and the lip lift, and I remember saying that on my one brow was always a little higher, and I'm like, well, that's just me, like, it could be my brow that I got tattooed that's higher, right? But he fixed everything, so it was really, really great. In terms of the brow lift, it used to be a big incision over the top of the head from ear to ear, flop things down and remove a lot of hair. Now we do it a more advanced technique. Many people still do it the old-fashioned way, but we make a little tiny incision here, a little tiny incision inside the hairline. With a small incision, we go in with a little scope with a camera on the end of it, and we do the entire operation on a video screen. We can see the nerves and blood vessels, pluck out the muscles that, you know, Sam likes to inject Botox to, and that way you won't need Botox quite as much. And then we elevate it to just the right level, and we can fixate it there. And then, you know, everything's out by a couple of weeks, and the progress is fairly consistent. Some people take longer though, you know, and sometimes people have more swelling into the neck, you know, depending on how much deep neck we have to do. So, you know, making sure that people are educated and that they're not, you know, too eager to kind of, you know, impatient. This does require patience to recover from this.
Yeah, I think the biggest thing was just the natural look and feel. Everyone that I've now talked to or sees me, you know, I was pretty open about it. It wasn't really something I wanted to hide. In fact, I was kind of excited that people knew.
Yeah.
But I think it's just like, they're just like this, you look so natural. And I think just you looking at the pictures when I was younger, and I mean, it was really, that whole process was amazing, and he did everything he said that he was going to do, and everything happened that his team and him said was going to happen. So there were really no surprises.
If you turn towards me just a little bit, you can throw your hair back over your ear. And again, you can see that the incision starts here, it follows the ear cartilage, it goes back inside the ear canal, just in front of the earlobe, and then it goes in this little sulcus right here behind, and then it blends into her hairline so she can wear her hairline up. There's no stair step, and
It's
so.
been about 3 months.
About 3 months, and again, like I said, Dawn's is a little bit farther downstream. Dawn's is still a little bit pink, you know, so you can still see them, but you know, take a look at those incisions, and you know, but there's a lot of effort that goes into that. I mean, closing the incisions alone, you know, will take us well over an hour, because again, we put tiny little stitches in. Not everybody does that. I didn't do that 20 years ago, but I'm doing it now because I've learned from these masters about how to unlock the ideal type of look. Any questions for Dawn?
Not for Dawn. How do you know if somebody's a keloid healer? Because I've been doing hair for 60 years.
I've
and
done
seen a lot
2,000
of-
facelifts, and I really have never seen a keloid on a face.
No.
Okay, usually if you're gonna get it, you're gonna get it on darker skinned individuals, and it's gonna be on their body. But like I said, that's even very rare, way less than 1%, and I've never seen them on the face. Yeah. Any other questions for maybe Dawn?
I just got asked,
Yeah.
this is a great question, if I have makeup on, and I've never been a big makeup wearer, and I don't really like to wear makeup, so I'd rather just wear like a tinted moisturizer, and that's what I have on.
Ooh.
Yeah.
Very beautiful. Dawn, thank you so much. We have to hand it to these patients, coming in, this is personal stuff, and then sharing their stories. But it is pretty helpful to kind of see. So thank you again. You got a question?
I just like the picture of her lips, and you said it was an upper and lower lip, but how much did she have to do the plumping, or
Yes.
did you put a
Typically when people age, and we're talking about just the lip, it's a microcosm of the entire face. Okay, so you have a lack of elasticity where things come down. Then you have a lack of volume, and then the exterior of the skin is also becoming aged. So for the optimal lip rejuvenation, it requires lifting, revolumization or plumping with their own fat, and then resurfacing with the laser. And then it kind of takes away all those lines.
Yeah, I've heard of all that before, but I heard really did such a great job. Her whole mouth looks bigger. How does she do that?
It's just,
She had sort of
she's
thin lips before,
You know what? I give that credit to God. She's very beautiful. Very
She
good.
is.
All right. What else? Okay.
Oh, you have the-
So what sets us apart? Well, first of all, our team. Our team has been with us forever. Like I said, my clinical director Morgan, who you've met, over a couple of decades. My PA's been with us for over 10 years. We have injection specialists that will maintain your beauty. We have managers here like Danielle. Thank you for being here, Danielle, and Mercedes here. In terms of scheduling your appointments, we have people here that are here to help you. These people are really dedicated to one thing, and that's helping patients feel good about themselves. So when we come to work, we're very focused on one thing, and that's that patient walking through the door. And it's just fun to come to work, to know and to work with other professionals that are like that. So the team aspect is, I think, what sets us apart. Also, I think also being relentless about techniques and results, and also being relentless about safety is very important. There's a lot of plastic surgeons out there. They don't really think about some of the things that can go wrong, and so we have to be set up for the things just in case. And that's why I like to have my anesthesiology team that's been with us forever. The average plastic surgeon is going to do how many facelifts do you think the average plastic surgeon does in a given month? The average plastic surgeon does about 1 or 1.5 facelifts a month. So about maybe 10 or 12, or maybe if they're kind of pretty busy, maybe 20 in a given year. Okay. And so, and that's pretty consistent. And so that's this line right here. So if they do, probably about 20 a year, if they've been in practice for 30 years, they're gonna do a certain number. My practice has kind of been broken down into different segments. When I first started, I was doing everything. A lot of bodies, a lot of breasts, I was on call at 11 different hospitals. And so I was doing some reconstructive work. But I joined a practice that already had a following with my two predecessors for being very elite when it came to faces. So as even a young surgeon, I was doing more. I was doing 2 to 4 a month, and then that doubled in the next 10 years because I really got good at it, and people started referring their friends, and that was even before we even got to the latest generations. Now we do about anywhere from 8 to 10 facelifts a month. So basically over that 30-year career, I've done about 2,000 facelifts. And again, it's not the number as much as it is the modification and the evolution that I think really sets our practice apart. And I got invited by one of my panelists when I was the moderator to go to St. Louis and do invitation only, top facelift surgeons in the country, and cadaver courses, and there was probably about 30 of us there. And we're talking about nuances, and we're showing before and after results, and we're asking ourselves, how could I have done this better? And somebody over here from St. Louis, or somebody from Alabama or Brazil might have a different technique. And so it's like a bunch of Lamborghini mechanics getting together and kind of talking about the little nuances of the firing of a spark plug, but you learn a lot just by being in that environment. And I'm really passionate about this. I love doing this. Obviously, we have some nice results here, but we want that for everybody, and we're always striving to improve. So we love what we do, and we're here for you guys. So thank you very much. What questions do you guys have? I know we went a little long.